Past 10 years, there's been some improvement in the technology. The focus has been to do less invasive techniques, less disruption of the soft tissues in the anatomy, but also there have been studies that have shown that the artificial disc replacements at this point appear to be doing better than the fusion surgeries. Historically, when we would do a decompression, take the disc out for arm pain, primarily due to a herniated disc or spinal stenosis. The space that's created between the two vertebrae has to be filled with something. And historically, we would fill that with a piece of bone or some plastic material that had bone in it, and put a small plate on it, and that would be called a spinal fusion. Mechanically, a spinal fusion takes motion away from the spine, which is not intuitively what the spine is designed to do. But we had no other option. And because it took motion away at a particular segment of the spine, it would put more stress on the levels above and below, and that's called adjacent segment degeneration. The chance of that happening is about 2 to 3% per year, depending on the problem that we're treating. But eventually, if you were young, there's a very high likelihood that you would need another operation at some point in your life. The artificial disc replacement, since it allows for movement, in theory, it's going to protect the levels above and below, as opposed to a fusion operation. You know, as I've gotten older as well as more experienced, it's nice to be able to focus. So I'm fortunate enough to be able to focus on the cervical spine in my practice. But the advantage is that this allows me to delve into some of the nuances and the subtleties of a patient's care, and also to customize the care for that particular patient. When you're trying to do too many things, you know, it's hard to specialize specifically and customize and optimize the care for that patient. So patients go home earlier, there's lower chance of infection, the chances of coming back to the hospital within 30 days is decreased significantly. So doing the same thing over and over in an environment where the whole team specializes in that particular treatment or surgical procedure allows the patients to just recover faster and have a better overall success rate. Giving a patient the option and educating the patient in terms of what their choices are allows them to accept the treatment that's going to work best for them. You know, it's hard to know within an hour or 2 hours what a patient's lifestyle really is all about, and the nuances and the details of what they like to do and what they do when they're home. Giving them options gives them the ability to customize and choose the treatment that suits their lifestyle the best. The most rewarding aspect is just having the privilege and the skill set to help people. You know, when someone's in pain and it's influencing their sleep, their lifestyle, they can't work, you know, their personal life is going down the tubes. And if it's related to a spine problem, you know, I'm very fortunate to have the training and the skill set and the education to help that patient kind of navigate and decrease their pain and get back to best function that they can.